Welcome, families, to another episode of Thriving Special Families. I'm your host, Crystal Sanford, your autism and IEP advocate. And I'm so happy to be here today with our topic, Unmasking Psychoeducational Evaluations. We have a very special guest today, Dr. Radha West. Hi, Dr. West.
Hi, thank you so much for having me.
So glad to have you here today. Thank you so much for your time. Families, if you are joining us via our podcast, then welcome and thanks for listening to another episode of Thriving Special Families. If you're watching live, we're so happy to have you as well. Feel free to add your questions or comments to the comment section, and we'll do our best to answer those along the way. And lastly, always note that the information that is shared here is for your informational purposes only. If you are in need of medical or legal advice, please do contact a professional in that area. So again, our topic today is unmasking psychoeducational evaluations. And so if you have a child with special needs, then at some point, and they receive services through the public school system, then at some point they will have or have had a psychoeducational evaluation. And so we're going today to discuss what does that look like? How can you maximize those evaluations? And what are some key things that parents should know? So let me give a great introduction to our guest again, Dr. Radha West. Dr. West is formally trained as a neuropsychologist, and she is passionate about working with children and families to ensure that they meet their greatest potential. Dr. West founded West Neurobehavioral Services in 2018 to further collaborate with families and professionals in ensuring that each person gets the highest quality and continuity of care. And so, Dr. West, we are just so, again, happy to have you here. I'm such a big proponent of story and the value of each person's story. I'd love to hear a little bit more about what led you to even becoming a neuropsychologist.
Sure. I started undergrad not knowing which exact direction I was going to go into, so I double majored in biology and chemistry. And then my biology mentor she took me under her wing and brought me into her neuroscience lab, and that's when I fell in love with the brain and wanting to learn more about brain behavior relationships. But also making an impact with people in the community. So initially, I was heading towards the route of becoming a neuroscientist, but again, still wanting that connection with people. And so she was the one who actually told me about neuropsychology. I didn't even know that it existed at that point. And so as I did some further research and took a biopsychosocial class, or a biopsychology class rather, then that just that was where my heart was and my passion was. So yeah, now I'm here.
Well, we're so glad because there's such a need for quality assessors and service providers in this area. So we're very happy that life turned out that way for you.
Me too.
So help us understand, what is the difference? You are a neuropsychologist, for many special needs parents and families like myself. I'm an advocate, I'm a speech pathologist, but I'm also a special needs parent myself. Help us understand the difference between a neuropsychologist and maybe other types of psychologists.
Sure. So all psychologists, we all have, the basic foundational skills of psychology and doctoral degrees. So we'll either have a PhD or a PsyD. But with regard to a neuropsychologist, we have additional training that focuses on brain behavior relationships, neuroanatomy, understanding testing, and more of the nuances around neurophysiology and such. So there's a little bit of in additional training as well in terms of clinical with the assessment piece. But we also can do therapy in some cases, but most neuropsychologists prefer to specialize in testing.
Okay, so really good to know. And that is different, let's say, from our school psychologists who primarily are trained to do their work within the school setting.
Correct, yes. So they're primarily focused more on educational differences and how to support that. Whereas with neuropsychology, we're looking more clinically in how the brain behavior relationships are working in multiple areas, in community, in home, and in school. And we would provide a clinical diagnosis if one is apparent.
Got it. Wonderful. Thank you for clarifying that. So now let's dive into the psychoeducational evaluation. What is that piece as it relates to children who have IEPs, let's say?
Sure. So psychoeducational evaluations through the school focuses primarily just on that, on the child's behavior as well as educational needs and how it can be supported through the school system. So again, it's not a clinical diagnosis that they usually formulate as they're not trained to do that piece. It's mostly focused on how they can support the child through the school. So it'll include a lot of the same tests that we use as well in the community, but we're more focused on the clinical aspects of child's functioning. And so even a psychoeducational evaluation from a private provider outside of the school would derive oftentimes a clinical diagnosis, such as a learning disability, ADHD, or autism, or something along those lines, a neurodevelopmental concern, and how that relates to, again, not just school, but how it may impact the child in a variety of environments.
Got it. Okay, wonderful. And so within the school setting, with an IEP, a child needs to have an evaluation to determine if they meet certain criterion and if they are eligible under certain eligibility categories, 13 under IDEA. And so that psychoeducational evaluation typically is a piece of that, but it is, again, just determining their eligibility for school-based services under IDEA and IEP. And I like what you're saying is that it's not provision of a clinical diagnosis or diagnosis. That's correct?
That is correct, yes. And so in some cases, children may not meet the criteria for an IEP, even with potentially a clinical diagnosis. Or vice versa, if they're not meeting, again, eligibility criteria through the school, then some parents will try to seek an IEE, which we'll talk about, the independent education evaluation, to further get a better understanding of the child's abilities or strengths and weaknesses.
Okay, got it. And parents, if you're just joining us, welcome again to another episode of Thriving Special Families, sponsored by Sanford Autism Consulting, where we offer IEP advocacy for families throughout the U.S. Our topic today is unmasking the psychoeducational evaluation for families. And so again, if you have a child with unique needs, if they have an IEP, then either they have or will have a psychoeducational evaluation as part of the assessments required to determine if they are eligible for an IEP. So we want to really dive in and learn more about this process and how we can maximize the time that our children have during these evaluations. So we've talked about eligibility under IDA and IEPs. in comparison to a medical or clinical diagnosis. So thanks so much for sharing about that, Dr. West. Here, our special guest. And you alluded to IEEs. So there are times, let's say, when a parent disagrees or has some concern about the school's evaluation, and they may request an IEE. And they could request an IEE in the area of psychoeducational evaluation. What role would you play in an IEE in that area?
So for an IEE, one of the requirements is to have an outside provider who's not affiliated with the school or school district to remove any biases. And so I'm one of those providers. I would contract with the school to evaluate the child, and it would be basically, again, depending on what we're looking at in terms of details of the evaluation. For the psychoeducational IEE, we'd look at not just the cognitive functioning and learning styles, but also addressing emotional functioning and seeing how all that interacts with the child and how it's impacting the child. And again, looking at their specific strengths and weaknesses so we can help formulate any treatment or support services or accommodations that are needed through the school. And part of that also entails observation in school, just to see the child in their environment and make note of that, as well as participate in IEPs meetings to, again, answer any questions and provide support through the clinical aspects.
Okay, great. So you can be pretty active in that process in helping to support teams and maybe give insight that hasn't yet been obtained when it comes to the child and their functioning. That sounds.
Absolutely.
Sounds like some very valuable information could be obtained through an IEE in this area.
Yes, many times it helps clarify, again, more specific strengths and weaknesses, because the psychoeducational evaluation through the school district is a little bit more limited in scope. And so what I provide and many other community providers provide is a little bit more of a detailed assessment or evaluation to really understand the child as a whole.
That's great. That's wonderful. I can think back to a child that I worked with because I spent over 20 years as a speech pathologist in public schools. And I can think back to an IEP meeting where a child, she had seizure disorder, and the parent obtained an IEE. And I remember being on that team and just listening to the results of that IEE and psychoeducational IEE, and the depth of information that was obtained was really valuable. Things that just hadn't been found or before, especially for this case, because she had, again, the seizure disorder with some neurological things going on. And so I feel as though it was just super helpful, and it really opened my eyes at that point as a district employee to see how much more information can be gained through an IEE in this area, and how that really helped to adjust the programming that she was receiving for this specific child.
Absolutely.
So we have another question here popping up with one of our frequent guests we have here, parents who's watching, Peggy. How often should these be redone? So I think we can look at that in two contexts. Thank you, Peggy. For the IEP, of course, the psychoeducational evaluation will be a part of your child's assessment every 3 years. A child's reevaluated. Now, when it comes to an IEE, if at some point a parent disagrees or has concern about the district's evaluation, a parent can at any point then request an IEE. Do you want to share anything and add some light to that, Dr. West?
Absolutely. Yes. So the school typically will do the triennial. Of course, if there are some significant changes, you can request an emergency IEP. And then with the IEE, typically for school-age children and above, it can be done annually, if just to see where the child is and how the services are supporting the child, in once we get baseline, and then we can compare the child to themselves. But again, that would have to be worked out with the school and the families, in terms of the best ways to do this.
Mm-hmm. Yes, definitely. I had another question. There are some parents who maybe are early, let's say early in diagnosis, early in identifying, where are their child's strengths and challenges. And sometimes I'll see parents that are independently looking for a neuropsychological evaluation, or independently looking for something close to this. And so what would your role be in that area, where just a parent, maybe through their own health insurance or through their own funding, they just want to get this level of depth of information?
Absolutely, yeah. I see the bulk of my referrals that are neuropsychological in nature come from pediatricians and come from other medical providers, teachers, and so forth. So they can come here or contact their insurance carrier in requesting one, and we do full comprehensive neuropsychological evaluations to assess different areas of cognitive functioning and emotional functioning, and again look at the specific strengths and weaknesses, and to help guide the treatment.
Wonderful. So if a parent obtains one in that way, let's say through their insurance, how often would you say that would necessarily be needed? Let's say a child had a really in-depth neuropsychological evaluation when they were 5. Do things change significantly enough that maybe a parent might want to pursue that again in a year or two, or maybe when they become a teen, or when would be best?
I think it's a case-by-case basis. So definitely, if there's concern or significant change, they may want to do it annually. But if there's not as much change that they're noticing, it can also be done as the child transitions to different milestones, from elementary to middle school to high school and so forth. To again help ensure and guide their that whatever supports they have are appropriate, and helping them meet their potential.
Okay, great. We have a few more questions here. Here's one from Vonda. What is your best advice when the district denies an IEP based on the fact that your child has good grades and is not failing? Mind you, those grades are hours of work and tears at home. This is a great question, and I think with parents being more involved in their child's education, with COVID and school closures, we're seeing more of this, where parents are aware that, wow, my child struggles more here or there. Maybe parents who were slightly concerned are realizing maybe we really do need to pursue an evaluation, and so they are pursuing. But then there's pushback, where the district says, oh no, they're doing fine academically. And I've seen this happen. It's very unfortunate, but the law does state that children can be eligible for an IEP if they demonstrate a disability that adversely impacts their educational performance. And I think that's where teams miss it many times, is that they're only looking at the academic performance, but they're not counting in the child's behavior challenges. The child maybe has no friends, they eat lunch alone, they have difficulty interacting with their peers in group projects, maybe they're hesitant to speak out. All these other areas that are involved impact their educational progress, and not just academics. So that's usually where we push back when I'm serving as an advocate, so that teams are following the law, because there's a really low bar when it comes to what's needed in order to do an evaluation. If a parent suspects a disability in any area, the team should assess, and they should not be pushing back. So that's my 2 cents. I don't know, Dr. West, if you want to add to that.
I agree. My whole vision is that every child needs to demonstrate their greatest potential, not just basic or minimum standards. And so when parents, I hear that quite a lot, where the school will deny the IEP because the child is meeting minimum standards, but it's not. But the parent sees that this child has much greater potential if they can just get the tiny little bit of support that is available. And so it's really, that's where the IEE would come into play, or a neuropsych evaluation. You'd have to go on your own to do that, to request that, and that will further demonstrate where the child's strengths and weaknesses are, and we can help with working with advocates and so forth to ensure that the child does receive whatever support services are most helpful to them, to really, again, demonstrate their greatest potential.
Yeah, that's wonderful. Yeah, and I love working with colleagues like yourself and helping to see children receive those supports. Sometimes, like you said, it's just some small supports. Maybe it's just some goals. Now it's another set of eyes working with explaining things another way for the child, and those few changes can really make a wonderful progress, and it could mean the world to a child. So.
Absolutely, and it can prevent from other mental health conditions down the road as well, because I am seeing a lot of kids coming in later on as teens that are stressed because they've never received support. They've worked so hard, and parents were with them hours in tutoring, and so the school doesn't know all the efforts that went into their grades, and the heartache and the pain, and then it leads to anxiety and depression in many of these kids. So
yeah, wow. So not even to mention the secondary things that can occur as well. Yeah. So we have another question here in regards to IEEs. Will the IEE be able to determine regression and or learning loss? If so, what areas of the IEE should I look at? Also, will there be recommendations on how to help the child catch up with typically developing peers?
So the IEE is looking at the child's current functioning. And so if there's data that's available prior to the initial evaluation or the IEE, then certainly we compare and contrast that information and see if there's been any change, whether it's a decline or whether there's been something else going on. And if there is such a decline, I think a neuropsych would be even more important in that respect, so that way we can really understand where the specific strengths and weaknesses lie, and how to help, not just academically, but across the board. So I think that will be important. So,
yeah, and I really agree. Right now, I think this is a big question for a lot of families, right? Because kids are getting back to school, and parents are realizing that, wow, compared to where they were, they have, they're really maybe struggling in one area more than another. And I feel as though a psychoeducational IEE could be very helpful in helping to substantiate a case for compensatory education, potentially if there's some significant regression or learning loss. And so, if a parent has a case like this, a situation as this, potentially they may share with their team, have, call an IEP meeting, talk about what they're seeing in regards to that regression, that learning loss, share those concerns with the team, and ask for some remediation in some form or shape or form, and see if what teams are willing to provide, what they're able to provide. If not, then it could potentially be a time when you're asking for an IEE, and a psychoeducational evaluation could be a good piece of that to show exactly where your child is performing, and then those results can be compared to where your child was, let's say, a year ago when they had an evaluation, or 2 years ago, or such. So I think that could really help a case.
Absolutely.
So we have another question here from Mary, adding to Vonda's the previous question. What do you recommend for parents do when they receive pushback with the district stating that they would only do something when there is already a problem? So unless the child starts to fail or show difficulty, the district will do nothing. They do not see how the child is actually being supported at home.
That's a great question. So again, going back to the law states that if there's any specific challenges at school, they have to receive accommodations. But also, if there's a clinical concern, if there's a clinical diagnosis, so that might be an area when you do seek an evaluation independently. Either, again, the neuropsychological or psychoeducational evaluation. If the school is not supporting the IEP or is pushing back, definitely reach out to advocates to help support that. And understand your rights with regard to that, but also another way would be just to seek an independent evaluation to determine if there is a clinical diagnosis that could potentially help, that potentially needs the support through school as well.
Right. And if a parent does obtain that private, let's say they go through their insurance, they obtain one privately, then they have the right as a parent, of course, to share that information with the team, to request an IEP meeting, share that with the team, and then ask the team to revisit the IEP to see what changes need to be made based on that private evaluation. And I'm sure you probably have been in cases like that.
Absolutely, yeah.
Yes. So, parents, if you're receiving pushback from your teams, and it's so unfortunate. I was just talking with a parent about this last week, but many times it is that teams are, quote unquote, waiting for the child to fail, or waiting to see some significant issue before they provide any type of service or move forward. But again, that's not what the law states. The law states that you have the right to request in writing an IEP evaluation, a special education evaluation, at any time that you suspect a disability in your child that's impacting them at school. So when you put that in writing, the team must respond within 15 calendar days. And then with that response, they either must grant you the evaluation, or they must provide you with written documentation that explains why they are refusing to do that. And that's called a PWN. And if you ask in writing, more often than not, a team is not going to push back because they don't want to write that letter and provide that documentation showing that they're refusing to, unless they are really, really sure about that. So sometimes just putting it in writing can make a big difference. And if they do refuse, you'll have it in writing, and you'll be able to use that as potentially a part of your case if you need to ever file a complaint. Okay. And so in our last minutes here together, Dr. West, what advice do you have for parents as they are engaging with their child in a psychoeducational evaluation, either through the natural IEP process or through the IEE process? What can the parent expect? What would they see happening and know that their child is receiving really good quality psychoeducational evaluation?
I think first and foremost, they need to understand, the purpose of these evaluations, and also understand the qualifications of the person that is administering these evaluations. I think it's critical that they know, the background of the evaluator and know their credentials. And in terms of also supporting this, making sure that you have all the documentation of previous records and previous, whether it's medical records or previous evaluations, IEPs, grades, anything else that can provide information as to your child's strengths and weaknesses, because the testing itself only is one data point. So we want to make sure that we're looking at the big picture, the whole picture, and how the child is functioning in various areas, and also to make sure that the person working with your child is accessing information not just from you, but from other sources like teachers or other providers. So that way, again, to get the full picture of the child.
Wonderful. And if a parent is, we have parents watching from all over, if they're not located in Southern California, so they're not able to access you as a provider, where can parents go to find out who might be a good fit for their child in a psychoeducational evaluation?
Yeah, they can, they can first go to the school district, to their local school district. Pediatricians know of providers in the community. There's also various websites like Psychology Today and state-affiliated websites. We have California Psych Association. There's the American Psychological Association. All of those provide, they have a Find a Psychologist tab where you can locate someone close to you. And of course, your insurances, you can contact them and see if any providers are local to you that provide such evaluations.
Awesome. And for parents who are in the Southern California area, we're here in San Diego, how can parents contact you, Dr. West, and learn more about your services?
Sure. I offer a free 15-minute consultation to discuss any concerns that they're having, or to clarify what types of evaluations would be most appropriate for their child. And they can contact me either by phone at 858-761-7184, or they can email me at drwest@westneurobehavioralservices.com. And then they can also check out my website, also westneurobehavioral.com. So.
Great. Well, there are parents out there who are in the San Diego area or Southern California area in need of a neuropsych evaluation or psychoeducational evaluation, then Dr. West definitely is one who you might want to be in contact with. She's a great resource to us here, and we're so glad to have had you here on our show.
Thank you. I'm so happy to be here, and thank you for this opportunity.
Awesome. So parents, thank you again for joining us for another episode of Thriving Special Families. Always remember that you're going to be okay, and your child's going to be okay too. Have a great day. Bye-bye.
Bye.